Hey, I'm Dr. Abram Arwood with Physiolab here in Tennessee, and today we're going to be talking about getting prepared for knee surgery. Having had two ACL surgeries myself, I understand that knee surgery it's just scary and it's kind of daunting, and you really sometimes you just don't know what's coming your way and how to set yourself up for success. So we're going to talk about that today. The first step is prep the home. More often than not, you're going to be coming home with crutches or a walker or something like that. Make sure to go through your house and figure out where you're going to be sleeping. Um, Try to figure out how close that is, so a bedroom or a couch or wherever you may end up is to a bathroom. Are you going to have to navigate stairs to get in and out of the house, or up to the bedroom or down to the bedroom? Um, but go through, figure out where you're going to be, and make sure that you have a clear path to get there. If there are rugs that may be getting in the way, if there are cords from floor lamps or anything like that that you could possibly trip over, go ahead and take care of that now instead of figuring out that it or finding out that it's a problem after surgery. Some other things to think about is bathing. Do you have a stand-up shower? Do you have a tub? Practice getting into the tub, and pretend that you have to keep your knees straight before you ever even get into the tub. Because if you have an ACL repair or ACL reconstruction or an MPFL repair, meniscus repair, some of these surgeries, you're more than likely going to be in a brace that has you locked out into extension. Now, obviously, you're not going to shower or bathe with the brace on, but you're not going to be able to bend your knee all that much either. So go ahead and make sure that you can get in and out of the bathtub or in and out of the shower. It may be worth looking into renting or borrowing a shower stool that you can sit in or sit on, just to make life a little bit easier. A pro tip with that is, before you sit on the stool, take the hot water and spray the stool. Get it good and warm. It's just not fun to sit on a cold stool whenever you're getting in the shower. Some other things to think about is ice packs. Some surgery centers or some surgeons will send you home with ice packs, or even a fun ice machine that wraps around your knee and circulates cold water to help with pain and swelling. Some do not. I will put a link in the down below to some ice packs that I got off of Amazon, and they're fantastic. They're also just good to have around in the months after surgery, whenever you just have occasional pain or swelling, or just slap them on something else or heat them up whenever you're cold. You can also do that. So worth the small investment to get some nice foldable ice packs. Some other things that we're going to talk about is exercises. These exercises are going to be very basic, and there's a good chance that, unless you had a very acute injury and you're going into surgery within a few days of getting hurt, you're probably going to do these exercises right now and think, this is really simple. And that's okay. I want you to practice them now so that you can start working on them even in the recovery room. These are going to be very safe. They're very easy. But after surgery and the trauma that the knee goes through, they're going to be a lot more difficult. So learning them now and figuring out those motor patterns now is going to make those first few days after surgery just a little bit better. So the first thing you want to do, anytime you have a knee surgery, everybody worries about flexion, how well the knee bends. The most important thing from a PT's eyes is extension. We can always do things to get you into better flexion. It's hard to get extension if you don't get it early on. So even now, start practicing tightening up your quadriceps, pressing your knee flat into the bed, on the ground, into a table if you're on a plinth like I am. A thing you can try is take a towel roll, put it underneath the heel so it's here, and that'll prop you up a little bit more, and you can press down into to get better extension and better quadricep activation. Then you will lay back. The next step is you're taking that quad set and turning it into a straight leg raise. Go up to about the height of the other knee and down slowly. This may feel simple at first, but start practicing. Next one you're going to do, take a belt or a dog leash, works really well. If you don't have a belt or a dog leash, bed sheets, cargo straps, anything long that does not stretch, put it around your foot. I like to cross in a figure 8 pattern. Some people do not. Some people don't cross at all, and start practicing a heel slide. So you're going up and down. I have shoes on, so it's catching on the bed. Socks work great for that, so that you're not catching on bed sheets or on the floor. But start getting that flexion now. We know that what you have going into surgery greatly impacts what comes out of surgery. If this is an elective surgery because of a meniscus pain or something like that, and you've had some time, or you have time leading up to surgery, start working on your strength training now. If you have questions about that, talk to your doctor, or better yet, find a physical therapist that is comfortable working with athletes who have surgeries and have them often, to start building yourself up prior to surgery. So if you have any questions, leave a comment down below. We'll be happy to help you as much as we can. And thanks for watching.